Hi, Dad. How much did I plan to pay for Medicare?
I talk to a lot of people about retirement, and I hear a lot of anxiety around healthcare costs in retirement. And I'm here to tell you those concerns, that anxiety, it's justified because year after year we see healthcare expenses, healthcare costs going up and up and up. But instead of just talking about feelings, let's talk about numbers. What costs are you likely to face as as you enroll in Medicare? Well, first, we know Medicare has Part A and Part B. Part A, hospital insurance. So for most people, Part A is premium free because you've already paid into the system as employees or via self employment taxes. So your Part A is premium free. $0 for premium for Part A. However, Part B is different. Now we're just going to assume that you're not eligible for Medicaid and Medicare, not eligible for any credits or discounts. This is how much Part B costs in 2024. The base premium for Part B is about $175 per month. This doesn't include IRMA, which is the additional surcharge that you have to pay if you have income above certain levels. This is the base premium, $175. Now, let's assume that you're enrolling in original Medicare. So you'll need a Medicare supplement, a Medigap plan. And let's just assume that you're going to purchase the most comprehensive plan out there available to newly eligible beneficiaries. And that would be Plan G. So how much does Plan G cost? Because you're going to need a supplement to cover the co-pays, some of the co-insurance. Remember, with just Part A and Part B, there's no out-of-pocket maximum limit. You want to cap those expenses. So you're going to need, on original Medicare, you're going to need a Medigap plan. So Plan G, and for the cost of Plan G and Medigap plans, it'll vary by location. But let's just say, a good estimate is about $175 per month. So Medigap. And this is G. $175 per month. Now, you're also going to need Part D, prescription drug plan. Now, you can get your drugs off discounters or other services like Cost Plus Drugs or Good RX, where they give you a coupon, get a discount on your drugs, and that's fine. But for most people, they're going to still want to enroll in some type of Part D prescription drug plan in the event that the drugs that they need are more expensive over there. And if you miss your enrollment window and you're late to enroll in Part D, you're going to have to pay a penalty for as long as you have Part D, which is probably going to be forever. So you want to enroll in a Part D prescription drug plan. And let's say you want to get most of your drugs on that prescription D drug plan. The premiums will vary a bit, but a good estimate to use for your forecasting, for your planning, let's just say $50 a month. All right, so Part D, $50 a month. So what do we have? 175, that's 350 plus 50, $400 per month. But we're not done. Because Medicare doesn't cover everything. Doesn't cover dental, doesn't cover vision, doesn't cover hearing aids. So how much is that likely to cost you? Well, let's just say an additional, $50 a month. So dental, vision, I could spell, hearing, aids. All right. About $50 a month. Oops. All right, so this 50, what's this? It's about $450 per month per beneficiary. So if you're a couple, you could be looking at $900 per month in costs. Now, a lot of folks think Medicare is free. It's not free. You could pay these numbers, then it's pretty solid coverage. It's pretty solid. It's pretty comprehensive, although it doesn't cover the dental, vision, and hearing. But you can buy those standalone for about $50 a month, give or take. I will say one thing too. For your Part D, this is going to vary, right? Depending on the type of medications that you're on, how frequently you need those medications. Like those, it's going to vary. But good estimate. So when you're thinking about, are you ready for retirement? Are you ready for those costs? These are the costs that you need to be ready for, or these costs, what you should be ready for. Now, also, Medicare doesn't cover long-term care. Very limited long-term care benefit. Yes, you got to fit in these narrow guidelines. So you got to plan for long-term care, and I'll talk about that in another video. But in terms of Medicare, this is what you're looking at. Potentially about $450 a month, and even more if you hit those IRMA limits, right? And there's additional surcharges. You may be paying more than this $450, more also based on your medications, or more based on where you live. If you're in a place that has very high medical costs, healthcare costs, like New York, for example, you could be paying more. But this is a good estimate. So plan accordingly, or else you're going to be surprised when you get into retirement. I don't want you to have to go back into the workforce because of these numbers. You may not even be able to go back into the workforce for that matter. All right, now you know.
I got it. That makes sense, Dad.